Hi, welcome back. Today we're going to be talking about androgens, cholesterol, and low testosterone. So men's sexual hormones are called androgens, with testosterone being perhaps the best known. All androgens start with cholesterol as the building block. Yes, you heard that right. Cholesterol is crucial. Many men in middle age are prescribed statins to lower their cholesterol, but lowering cholesterol can also lower your hormone production, resulting in less testosterone. The body needs cholesterol for hormone synthesis and for brain health. So over-aggressive use, and let's face it, that's everybody, and over-aggressive use of statins can actually reduce your hormone production, leading to lower testosterone and DHT, both of which I would argue are vital for men's health. Now, as men age, testosterone naturally drops and estradiol, a form of estrogen, starts to rise. Now, that's normal and has some beneficial output, but our modern environment is full of pollutants, plastics, and we have consumed things in our diet that have made changes much more dramatic, accelerating the onset of andropause. That's the male version of menopause. How do you know that you might be suffering from low testosterone? Because it's often overlooked. It is linked to low libido and erectile issues, but not just that. So it can disturb your sleep with insomnia. You can suffer from depression, fatigue, irritability, heart disease, atherosclerosis, osteoporosis, a thinning of the skin, and you could suffer from joint pain, muscle weakness, and hot flashes. You can also suffer from poor memory and brain fog, inflamed prostate, and you're at risk of testicular cancer, as well as there being some ejaculatory problems and weight gain, otherwise known as the glorious dad bod. Now, the transition is called andropause. I tend to think of this as grumpy old man syndrome. As you age, you get new emotions and your mood starts to change, and it can often lead to us wanting solitude and an opportunity to try and find coping strategies in the potting shed or the man cave. Now, I talked a little bit about estrogen. There are xenoestrogens, and it's a hidden threat. And there's plenty of talk about plant-based estrogens and xenoestrogens. These are plastic-based estrogens and the role that they have to play in females' health. But there's little talk about what their impact might be in men's health. These xenoestrogens can mimic estrogen in the body, reducing testosterone, and contribute to earlier and more dramatic andropause. Similarly, there's very little conversation around phytoandrogens. These are plants that support male hormones like testosterone. So whenever it comes to the phytoandrogens, just exactly what is it we're talking about? We're talking about plant-derived compounds that can support, mimic, or modulate the body's production and function of androgens. Unlike direct hormone therapy, phytoandrogens work by stimulating the body's own testosterone production, blocking excess conversion of testosterone to estrogen or to DHT, and reducing sex hormone binding globulin. This is SHBG, which also helps increase free testosterone. The plants will also support the hypothalamic pituitary and gonadal axis. This is the HPG axis for hormonal resilience. Now, the key phytoandrogenic herbs, their origins, their actions, and their evidence. Well, first up is ashwagandha. It is a root from India used in Ayurvedic medicine, and it works as an adaptogen. It helps to reduce cortisol, which is a stress hormone that would otherwise suppress testosterone, and it has been shown to increase testosterone, sperm quality, and vitality in men. Now, the constituent in the extract is called the withanolides. It improves stress, resilience. It helps boost sexual function, energy, and muscle mass. Next up is pine pollen. So pine comes from pine trees, and it contains small amounts of plant-based androgens. This is testosterone, DHEA, and androstenedione. Now, while the actual hormone content is really quite low, it's important to note that the body doesn't require an awful lot of testosterone to create significant changes. Consider the amount needed to turn a fetus into a boy or to drive puberty. it is actually a very small amount of free testosterone. Even a modest level of hormonally active phytoandrogens in pine pollen may help support androgenic activity and balance your hormones. So to take this, I would suggest taking a powder and about 1 to 3 grams of pine pollen twice a day, or the tincture. Now, the tincture will have a little bit more bioavailability of some of the hormones that you would want, but the extract is a little bit weaker. So it's usually a 1 in 3 or 1 in 5 extract. So you're probably needing about 2 or 3 mils of tincture 3 times a day. Now, this is good for boosting libido, your energy, and your mood. And there's quite a lot of support now to suggest that it's helpful for mild testosterone deficiency. Shilajit is a mineral-rich resin from the Himalayan rocks, and it works to enhance mitochondrial function, which increases testosterone and DHEA. It supports energy and recovery, and it contains fulvic acids and trace minerals. Usually you're taking about half a gram a day of the purified extract, and it helps to increase testosterone, helps to increase stamina, recovery, and sexual function. Tribulus terrestrius is a Mediterranean herb, and it's the fruit that is used, and it works because of the impact that it has on luteinizing hormone. It helps to increase that, stimulating the testes to then produce more testosterone. It also improves nitric oxide, which is important to enhance and keep an erection firm. And the dose for tribulus is usually in and around 500 micrograms to 1,500 micrograms a day of standardized saponins. The impact of tribulus on men's health is that it can help boost libido, erectile function, and it may support testosterone in men with low baseline levels. The ginsengs are up next. So this is Panax ginseng. It's a root from Korea and from China, and it works as an adaptogen. It helps improve the HPG axis, signaling increasing nitric oxide, improving your erections, and it supports testosterone and sperm quality. Usually the extract for that is about 200 to 400 micrograms a day. The impact is that it enhances energy, sexual performance, and stress resilience. Tenchi ginseng, this is Panax noto ginseng, is very similar. It comes from China and it works similarly to Panax, but more focus on circulation, on cardiovascular health, and recovery from fatigue. It supports blood flow, heart health, and physical recovery, and is clearly associated with testosterone. Siberian ginseng, this is Eleutherococcus syntycosus, is a root from Russia and Asia. It's not a true ginseng, but it is an adaptogen and it supports adrenal and immune function. It helps the body adapt to stress, so therefore will indirectly support testosterone by reducing the stress burden. Usually the dosage for this is around 300 to 1,200 micrograms a day. It improves stamina, recovery, and resilience. Nettle root. We're all familiar with nettle, but it's the root that helps to reduce sex hormone binding globulin, which then increases the amount of free testosterone that's cycling in your system. It supports your prostate by inhibiting conversion of testosterone to DHT, and the dose for it is in and around 300 to 600 micrograms a day. Also has an impact on limiting and reducing the amount of estradiol in your system. Now, the impacts are that it improves urinary health, libido, and it may help increase free testosterone. How much is needed to create change? Well, most studies use standardized extracts for at least 4 to 12 weeks. Now, the effects are more pronounced in men with low baseline testosterone, not the people who are completely depleted. Consistency is the key, so you want to combine this with healthy lifestyle options for best results. Now, there are other things you can do, such as supplements, and I want to talk a little bit about the why, what, and how. So DHEA, pregnenolone, and androstenedione are natural hormone precursors, and supplementing with these can help the body produce more testosterone in your system, but it should be done under supervision. Zinc is essential for testosterone synthesis, and deficiency is really common, and it helps to lower testosterone if you're deficient in zinc. So supplementing at 15 to 30 micrograms a day can help restore normal levels of testosterone. Now, when it comes to lifestyle factors, you want to really try and get out and get physical. So Physical exercise will increase your testosterone, especially strength and resistance training. It improves your mood, your energy, and your body composition. Interestingly, meal bonding is really useful. So the social connection and the camaraderie that you would see amongst the brotherhood is usually good at increasing the amount of oxytocin. Oxytocin reduces stress and supports healthy testosterone. So the men's banter in the changing rooms is actually something that is hormonally stimulating and good for us. Eroticism. So healthy sexual expression boosts testosterone, mood, and confidence. Suppression or shame will lower hormones. And then medications. So why do they matter? Well, many drugs lower testosterone by blocking production, increasing clearance, and raising estrogen. So anti-inflammatories, the non-steroidal anti-inflammatory drugs, inhibit enzymes needed for steroid hormone synthesis. Antibiotics, antifungals, they disrupt the gut, affecting hormone metabolism. You have statins, which lower cholesterol, which reduces hormone production. Antidepressants and antipsychotics that suppress the HPG axis. Heart and blood pressure meds, well, some beta blockers, calcium channel blockers, and antiarrhythmics inhibit testicular function or hormone signaling. One to consider. Onto herbs and foods to avoid. We want to try and reduce the amount of beer you're taking because hops is a no-no. It is very strongly connected with elevating the amount of estrogens in your system as a phytoestrogen. Licorice and black cohosh and grapefruit can increase estrogen and suppress testosterone. Now, what I would say is it's always best to work with a qualified practitioner for safe and effective use. But there are some foods that are useful to take. So things like celery, corn, cucumber, kale, spinach, radishes, oats, red meat, pine nuts are all foods that are thought to support androgenic activity or provide nutrients important for hormone production. So well worth putting into your diet. That's it for now. Hopefully you find that useful. Take care. See you next time.